Hi, and welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Today on the show, Ann Gillies is here, PhD, as well as John Euler, and a special guest, Dr. Jay Allen, MD, is back. We've got a lot to discuss. Gender affirming care is actually conversion therapy. I have trouble saying it. I'm in Canada. We have rules, laws, and everything else to go against this. But as of today, we're going to speak freely. We're going to discuss this because they just can't keep us down, and they can keep trying all they want. Today on the show, I'm happy to welcome all three guests at the same time. John, Ann, and Jay, thank you very much for being here. John, there is so much to talk about. They've put a block on discussing these kind of issues here in Canada. Obviously, this is an American program paid for by Americans and produced here in Canada, or edited here in Canada. I want to make that clear now, just to keep myself picking and choosing my battles going forward. I will do my due diligence to let the Canadian government know exactly where I fit into this mix. Dr. Ann is Canadian as well, and she knows the laws, she knows the rules, she knows the boundaries, and she knows the line that she's allowed to cross or not cross. If she goes over it, well, that's up to Dr. Ann to take that opportunity to say what she needs to say, and we welcome that every step of the way. John, how's your day going today so far, sir? Let's get right into the show. Where do we start with this?
Well, Brad, your introduction was perfect because look at what has happened. Talk about the suppression of truth, right? We on this program, we're not anti-anything. We are pro-truth, and we're pro the protection of women and children. And we are mindful of every word that we say, because what people need more than anything is truth, because only the truth is going to set people free. It does not help to push a delusion. It doesn't help to push a lie. People need help. We are here to dispense truth and dispense help. In this day and age, with such confusion and with such vulnerable kids being exploited, right? If you take advantage of someone, you are exploiting them. People only can get better and move through journeys of healing when they are fully informed, so that they can be given and meaningfully give full consent, right? If you pull the wool over somebody's eyes, whether purchasing a car or whatever, if you don't give full disclosure, then they cannot fully consent. And I have addressed that in Dr. Ann Gillies. It's so good to be back with you on screen. And we have Dr. Allen, who has felt compelled. But Dr. Gillies, you have been addressing this, and whether governments want to try to suppress full information so that people can make fully informed decisions for themselves and their future, we feel compelled that as clinicians, we're still obligated to give full information.
I agree with you totally, 100%. And one of the things I often say to people, telling the truth is kind and it is loving. And as a parent, I mean, lying to my children was not something that I ever entertained. I mean, some people might call this even a little overboard, but I found it difficult to embrace Santa Claus. And that's whatever people want to do, but because it's untruthful, because the real reason we celebrate Christmas is because of the birth of Christ. And so that's here nor there, but I am so committed to telling the truth. And I think our children now are so, and I'll use the word, indoctrinated by lies, absolute falsehoods, that are biologically truisms. They are now turned upside down. And Dr. Allen, you're going to talk about this. I think it's really, really good that you're going to be able to spend some time talking about what really takes place with gender affirmation.
Yeah.
So, Doctor, welcome. Thank you. And you have just written another article. As a matter of fact, I'll bring it up so you can tell people where they can find it. because this is a specific main newspaper, but people can access it. So you recently just wrote this article published August 18th, 2023. Gender affirming care is conversion therapy. So talk to us. First of all, I also want to let the audience know that there's a reason why you are feeling compelled at this point in time in your life. You're a physician. You are now retired. I'm going to go back to full screen here. But you felt compelled at this time in your life because you have been diagnosed with cancer.
Correct.
And
so I have cholangiocarcinoma, and the last time I went with the oncologist, he said I had about 2 to 3 months to live.
So we're going to be praying. We're going to be praying for you. But that's why your words carry all the more weight, because when somebody is faced with a limited time, they start hopefully putting priorities in order. You have done that. You've lived an upstanding life. You've been in private practice for decades. And so talk to us first, we know what caused you to speak out, but last program, and I want to encourage people to go back to the previous program, because we addressed another topic, which again, gender assigned at birth. So that was the first one. So as a medical doctor, right, you made some comments. So in brief, talk to us about what we covered there, and then why you are addressing this issue now of the real conversion therapy.
Yeah. So as a doctor, I did family practice. The majority of that time was with the U.S. Army. And when you work for the Army, you do what they tell you to do. So one of the responsibilities I had during one of my duty stations was covering labor and delivery. So I've probably delivered over 200 babies at this point. My wife thinks it was 300, but I lost track. So anyhow, at least 200. And not once did I guess at what the baby's gender was. Every time it was very obvious. Now, I did do a genetics rotation at Children's Hospital of Philadelphia. So I worked with a geneticist, and I asked her, what about kids with ambiguous genitalia? And she said the way she responds to that, and this was back in the 90s, she said she'll tell the parents that you either have a boy with an undergrown penis or a girl with an enlarged clitoris, and we'll have to do more tests to figure out which it is. But the chances of me having delivered someone who is intersex were minimal. I mean, 1 in 5,500 births is intersex, and most of those are fairly clear about what gender they are. There's only a small number that are not. So this thing about intersex is just a way to confuse the waters even more and make it more difficult to understand what's really going on. Because the vast majority of people who identify as transgender do not have any intersex issues at all. I mean, we're seeing, 10-20% of people identifying as transgender, and that's nowhere near the numbers for the intersex. So, and part of the reason I got involved with this is I have a granddaughter. So 5 grandchildren altogether, only 1 is a girl. And she has started to talk about thinking that she's a boy. And I wanted to do some research into what I could do to help her and understand this issue more. So as I was doing work on the transgender issue, one of the things that came out was that up until about 5-10 years ago, there were really 2 methods to deal with transgender issues. There was the watchful waiting, which was primarily advocated by Dr. Zucker. And then there was gender affirming care, which started off with the Dutch protocol, but quickly expanded to other areas. And about 2015...
Dr. Allen, I'm sorry to interrupt. Could you explain for the audience what the Dutch protocol is?
So the Dutch protocol, basically what they were trying to do was affirming the gender of the child. So the child comes in, says, I think I'm a girl, and they interview her or him and say after a period of time, yes, you are a girl. Depending on the age, they'll start puberty blockers, and then they'll move on to wrong sex hormones. After that, they move on to gender affirming surgery, as it's called, which for girls can involve just double mastectomy, can also involve hysterectomy.
And it's amputation of sex organs.
Yeah.
And it's interesting. I just wanted to kind of butt in here a little bit, Doctor, and say it's interesting how the language has been so skewed, because what used to be called sex reassignment surgery is now called gender affirming surgery. You see, everything is made to look. What do we call it? We call it queered. Everything's queered. It's upside down, and instead of calling natal sex, we call sex gender. Everything is so convoluted within the LGBTQ umbrella as far as language goes. So even, the sex assigned at birth, like you said, it is, it's not assigned, right? There's no assigning. It is or it isn't. This is a boy, this is a girl, and it's very identifiable, except for a medical anomaly, which I'm just trying to think of the term, because intersex even is a term that's been kind of conscripted by the LGBTQ. And like you said, there's very few. I think it's only like 0.6% of the population, 0.06%. That is actually that has a medical condition that is
disorders of sexual development.
That's it. Thank you so much, because my brain was, and that's but it got changed to intersex, and there really is no such thing, even by what you're saying, because the other doctor, the geneticist that you talked with, then said, you either have this is a boy with, an enlarged clitoris, or no, the other way around. I'm confused now. But the reality is identifiable, and even by chromosomes, right? So that down the road, they can actually tell now whether this is a boy or a girl. They're still identifiable.
Correct. Yeah. So one of the things as I got into this more was, I was comparing these two different strategies for treatment, and I saw how the people who supported the watchful waiting were marginalized, ostracized, and kicked out. I mean, Ken Zucker was one of the big names in gender care for years, and yet they kicked him out of the inaugural meeting of the U.S. PATH, which is the United States, I forget then, it's physicians or professionals for therapy, transgender health, something like that.
Yeah.
But he was kicked out of that meeting because he was part of a panel, and he represented the watchful waiting view. And there were non-medical ideologues who objected to that, managed to get him kicked out. He was supposed to be on two other panels. He was kicked off those two panels and disinvited from the meeting. And then, there's also Dr. Lisa Littman, who talked about what's called ROGD, which is rapid onset gender dysphoria. And it's a phenomenon that's come out in the past 10 years or so, where the numbers have basically flipped. Initially, it was young boys who, from the age they could start talking, said that they were female. What we see in the current group of people identifying as transgender is that they're largely pubescent and prepubescent teen females. About 70% are females. In the past, the kids were excluded if they had any psychiatric issues, but in the current cohort, what we see is that there's a lot of psychological issues, depression, anxiety, PTSD, sex trauma, all sorts of stuff. And in the past, that would excluded them from any of the studies or any of the treatments. And what we're seeing is that the transgender activists are ignoring those psychiatric issues and treating it as, so they're saying that the depression, the anxiety, they're all symptoms of the gender dysphoria. We treat the gender dysphoria, that will go away. They even say that about autism.
That's right. And one thing I just wanted to make sure our audience knows is these are pre-existing mental health conditions that that were already evident prior to the child declaring they were born in the wrong body. And when you say autism, I read recently, and I talk about this, that almost all these children are on the autism spectrum. Previous research was, between 20 and 30%, but now what I'm reading is almost all are on the autism spectrum, and they either have been diagnosed or will be diagnosed. They haven't yet been diagnosed because it really hasn't identified itself. So these are very vulnerable children you're talking about.
Yeah. So in 2018, the American Academy of Pediatrics published a policy paper written basically by one physician, Dr. Rafferty. And in that position paper, he came out and said that watchful waiting is a form of conversion therapy. And I said, wait a second. So I started taking a look at conversion therapy more closely. And, most of the studies that were done on conversion therapy were done on homosexual males. So that's where all the data comes from. They're starting to do studies on transgender conversion therapy, but most of the data they talk about comes from homosexual males. And, there have been numerous states that have banned conversion therapy, and all of the major medical associations have banned conversion therapy. And there are two reasons that you could consider why they might ban conversion therapy. One is that the outcome, so let me define conversion therapy first. It's a broadly defined interventions imposed with the intent of promoting a particular sexual orientation or gender identity as a preferred outcome. And part of the reason that it's frowned upon is because of some of the techniques that they use for conversion therapy. And those techniques included electrical shock, surgical or chemical castration, deprivation of food and liquid, and chemically induced nausea as part of aversion therapy. So when you talk about banning conversion therapy, there can be two reasons. One is you don't like the outcome that they're striving for. So homosexuals might oppose gay conversion therapy because it turns gays into homosexuals, which they've found is ineffective. So that's not really an issue. Or the other reason is that you frown upon the techniques that are being used. But to call gender watchful waiting conversion therapy, there are really not any issues with the treatment itself. It's basically just talking to patients. So the only complaint they could have is that it's preventing people from adopting a permanent trans identity. And that's really the only reason they could call it conversion therapy.
Can I go back just to something you were talking about when we were talking about the practices? And you identified many of them. Those practices, the therapists have not used those techniques in 50 years. Like, as they're obsolete. They were long ago outlawed because psychiatrists and psychologists realized that this was not an appropriate way to help a person who was struggling with sexual issues. And so that isn't even really, in some ways, I mean, even though that's what the conversion therapy bylaws talk about, and the federal laws, but that John,
let me mention,
here he goes. Go ahead.
Oh gosh, I think of Sam Brinton. Okay, here in the U.S., remember the luggage stealing deputy director of spent waste and fuel in the Department of Energy. Okay, Sam Brinton is a criminal, so I can say he has a criminal mind. He stole women's luggage. He had the temerity to wear the designer clothes, right? And to use the luggage, actually, to go on as he was teaching BDSM stuff. You notice he never returned the underwear, because my contention is he used it to masturbate. Now, we may have shocked our audience, but what's interesting is this. Sam Brinton was on a mission to do away with conversion therapy. Yet it turns out that he couldn't recall any details about who the professionals, so-called professionals, were. He couldn't remember names. And so part of my critique about this so-called conversion therapy is twofold. One, we're taking anecdotal firsthand reports. So I wonder really how many people underwent this so-called conversion therapy. People's stories, but we could have the world's greatest liars like Sam Brinton manufacture a story. His family said he never went, Sam couldn't recall who the therapist was. Okay. And I don't know of any therapists. I mean, I don't have electroshock therapy material. I don't even believe in it, number one, but oh yeah, hold on, client, let me turn around. I have my box here. My box of electrodes. We're going to hook you up. Who does that? No one I know has ever had any electrical equipment in their office. Like, if that happens, it would be, and I'm against, personally, when people do use electroshock therapy for depression. I don't think any good outcome, but that's going to be in the medical field. Dr. Allen can speak to that. But I think it is a ruse, it's a misnomer to say that this thing has been widespread. But all things being equal, the role of a therapist is not to change someone, it's to facilitate them accessing and getting in touch with their own values and making sure there's consistency, because we're only going to be as healthy as we align ourselves with our values. Now, if our values have been unduly influenced, we used to call it brainwashing. Now you can have someone, so this comes full circle now back to Dr. Allen, what you were writing about, which is, if watchful waiting in that term, it basically means, let's give this some time. Is this a fad? Has this kid been unduly influenced? Has somebody in their school been working on them as far as their mind, telling them, your parents really don't care, and I really think you're a boy, you're not a girl. And so they're being fast-tracked. And so all this watchful waiting approach simply is saying, let's hold off, let's give it some time, and let's see. Yeah. Yet now they want to fast-track this. Talk about, so your contention is that's the actual conversion therapy.
Yeah. And one of the biggest things that frustrated me is that, to me, it's obvious that gender affirming care is conversion therapy, and it's condemned widely by all the medical organizations, but gender affirming care is endorsed by those same medical organizations. And the thing that really struck me as ironic is that conversion therapy used to use chemical and surgical castration. And who's recommending chemical and surgical castration now? It's the gender affirming care people.
Exactly.
And I said, this smacks of conversion therapy. And so I took a deeper dive into the aspects of conversion therapy, and almost every single aspect of conversion therapy matches up with gender affirming care. So, for example, gender affirming care seeks to concretize a specific gender. So their goal is a particular gender identity. And they do that through starting with social transition, and that alone can be enough to concretize the gender identity. But then, each step along the way, you're further concretizing that gender identity. You talk about conversion therapy being torture, cruel, and inhumane, and contrary to human rights. Well, what they do to these children is absolutely cruel. They tell them that in order to be their true selves, they have to medicate themselves and mutilate themselves. That's a cruel statement to make to anyone, let alone a child. Gender affirming care is inhumane. It takes someone who's physically healthy and turns them into a lifelong patient that will require hormones and occasional surgeries throughout their life. Gender affirming surgery for females is basically female genital mutilation. That's another treatment that all these medical organizations have frowned upon and spoken against. But when it comes to the gender affirming care, they're all for it. And that's the most, what's the word I'm looking for? The most extensive form of genital mutilation you can think of, because they're taking everything out.
Yeah.
And yet they accept that as perfectly normal, even though they condemn the overall practice of female genital mutilation. So
it's interesting also the issue of consent. That comes at the critique of conversion therapy. The client wasn't able to consent, but Dr. N, you've also addressed this, right? That if you fast track a kid, like a kid can even consent, like a kid can conceive of what's going to happen as far as sterilization.
No, and those.
The ironic thing. Go ahead.
Oh, I was just going to say that children do not have the mental capacity to consent to something that they have no concept of the outcome, like really. And not only that, most often, at least what we've seen and heard, is that these children are not even they're not even given the instruction or from the doctors or the risks advisory that you would normally have if someone is sick, and even on medication. Here are all the side effects, and all of those pubertal blockers, hormones, they all have tremendous side effects, and yet the children are just being pushed through this conveyor belt onto this mutilation. So yeah, that's about consent. That's just such an out there term anymore. Consent. There's no such thing that a child can consent to such stuff.
Well, the other thing too is that the gender surgeons and gender clinicians are so blind to the harmful effects of what they recommend that they can't really give a full consent because the doctors are not able to explain to them the full hazards and harms that come with these interventions. So there's no way they'll be able to give a full consent. Plus,
Doctor, as a matter of fact, as a medical doctor, can you speak to that? We've had other doctors on before, but I don't think our audience can hear this enough. So talk to us briefly about your concerns when you fool around with the endocrine system and wrong sex hormones.
Well, basically, there's all sorts of issues when you put people on puberty blockers and you put them on cross-sex or wrong sex hormones. And they're finding more and more evidence. First of all, transgender patients live about 10 years shorter than a non-transgender patient. They're more prone to cancers, heart attacks, osteoporosis, all sorts of different issues. If they've had surgery, they're prone to infections because those are not natural structures. They're not reconstructing natural things. They're constructing false things to look like the opposite sex. And there's all sorts of problems with those. In fact, one of the people in the initial Dutch studies, a kid, died because they were trying to put part of the colon to make what's called a neovagina. and he died from sepsis following that surgery. Yeah, it's harmful all around.
That should have been enough to stop the trials right then.
It should have. Yeah.
Yeah. I mean, it's murder. If you want to really, I mean,
this is just, it's Nazi-like medical experimentation.
Mm-hmm.
Yeah, it is. And several of the gender specialists overseas have made that same comment. It's experimentation. But the Americans say, oh, no, it's widely accepted and it's standard of care. So, but going back to conversion therapy, it's administered coercively. So we see that when they try to when they look for informed consent, there are basically a couple different ways that they do it coercively. Number one is the phrase, would you rather have a living son or a dead daughter? Or the vice versa. And that strikes fear into the hearts of parents. You know, the thought their child might commit suicide if they're not affirmed. And by the way, that statement is absolutely false. There is no significant benefit from starting affirmative therapy in terms of suicide rates or suicidal ideation. And most of that suicidal ideation comes from the underlying psychiatric issues they have. So that's a false statement. In fact, the top pediatric gender physician in Finland has called this purposeful disinformation and has said that spreading it is irresponsible. And another thing that they do is they involve child protective services or the threat of child protective services. And they say, if you're not affirming, then, if you're not affirming, then we're going to take your kids away from you because you're denying them life-saving care, which again is a false statement. It's not life-saving, it's life-altering, it's life-destroying, but it's not life-saving. So those are two ways that they're coercive about getting permission to do this transgender care.
Dr. Allen, I'm aware we're up against the clock for this particular episode. Would you be willing to stay right there and continue with us?
Sure. Yep.
Brad, I'm telling you, I'm thinking you as a dad, you're in Canada, you have a daughter, what you're saying, what your daughter is probably sharing, it just is mind-boggling to think that there are supposed professionals out there that have so bought this agenda that they're pushing this kind of stuff on minors. It's infuriating and it's mind-boggling.
There's a lot of lies. There's no question about that. This whole gender affirming care and the whole topic is very disturbing, and it's very, very much filled with so many lies for these kids. You're allowed to go see the therapist to get the help. The therapist turns around and lies to you throughout the whole session, sends you away thinking, I've helped that individual, but all you've done is leave them more confused and more traumatized and scared than ever before. There's no help here. There's no help. This is a mental issue that needs discussion, it needs openness, and it needs a lot of time to provide the healing that's needed internally before any child should, and any parent should ever allow this sort of a decision to be made. The doctors should not be making these decisions for these kids, period. These kids should not be making the decisions for themselves, period. It should be a combined effort, no different than what we face in the schools with the SOGI 1, 2, 3 indoctrination program. It all ties together. That is why we do this show each and every week and each and every other day. So thank you very much to all three of you for being here. Remember, everyone, you can find our episodes on Rumble, BitChute, or on YouTube as well. This is Unmasking the Trans Movement. Please see our website, unmaskingthetransmovement.com. Till next time, please remember, it's not our kids' fight, it's our fight. We'll see you next time.